So in a previous video, when I talked about having an uncomfortable conversation with your doctor about avoiding and supporting your wishes to have an episiotomy, I spoke about the use of local anesthetic. Now, a local anesthetic is an injection that is given to you while you're in labor before an episiotomy is done, and it's an injection of local anesthetic directly into the perineum. Now, that's the area of skin between the vagina and the anus. And the reason they give you that local anesthetic is to numb the area before the episiotomy is done. The reason I'm bringing this up is because from my experience in hospitals is very often that local anesthetic is given before an episiotomy is actually necessary. The reason given that we're doing it just in case. And it's really important and may sound completely counterintuitive and seem really scary because obviously you want to if somebody's going to cut that area, you don't want to feel it. So in other words, you would prefer to have the local anesthetic. Here's why it should be avoided. And the best way of me explaining it is looking down at your hand to this area of skin between your thumb and your forefinger. And you can see that if you stretch it out, how thin that skin is, almost that area. And that's essentially what happens to the perineal and to the vagina when it stretches open is that skin gradually becomes thinner in order to stretch. And the vaginal tissue is designed to stretch and thin and accommodate the size of the baby and the passage of the baby through the vagina. And it's the process of that baby coming down, and the slower it happens, the more time the vagina has to stretch. Now, an episiotomy should only ever be done when the baby's head is actually crowning and the perineum is already thinned out. And at that stage, the perineum is pretty much stretched to the maximum, and you are already experiencing intense stretching and burning sensations. Any tearing that occurred naturally or a surgical cut would actually be felt as a relief, even if there isn't a local anesthetic, because there's already such an intensity of sensation there. If, however, an injection of fluid is inserted into that thinning tissue, because of the nature of local anesthetic, we need to give you at least 10 to 20 milliliters of fluid, which is around about 2 to 4 teaspoons. Now, if I inject that entire area with 2 to 4 teaspoons of fluid, what happens is that the interstitial spaces, the tissue, actually swells and fills with the fluid. So although that fluid is numbing the tissue, it's also swelling it and filling it, and it's unable to stretch anymore. So what I saw when I was working in hospitals where the injection was given just in case was that as soon as we'd given that injection, that tissue was now unable to stretch. And although we had given it just in case, it actually now necessitated an episiotomy. One, because the tissue was unable to stretch anymore, and two, because I've taken away your sensation and your ability to work with that. Because as scary as what that burning and stretching sensation seems now when you're sitting and thinking, oh my goodness, I can't imagine baby coming out and it's so big and it's going to be so intense. That actual sensation of stretching usually lasts no more than a minute or two, because what happens when you feel that is that release, is that pushing through, and as soon as the baby's head passes through, the burning and stretching eases because the bulk of the widest angle is through, and you're working with that to birth your baby, especially if you're using the tools and techniques that you learn in this course. So what I'm saying is that when you have that conversation with your doctor, what you want to say is that you do not want to be given local anesthetic in the event in case you need an episiotomy, that an episiotomy, it will only be done when an episiotomy is actually necessary and not before. And even if an episiotomy or tearing occurs without local anesthetic, the sensation would be experienced more as you will feel it, but it will be experienced more as a relief. The local anesthetic would definitely be given afterwards for the repair, because it is actually the repair that is so uncomfortable, and it's the repair where local anesthetic is absolutely vital and essential so that you don't feel the suturing of that perineal tissue. And when the local anesthetic is given afterwards, if there is any tearing or if an episiotomy has been done, then it can be given directly into the tissue that has been separated in order to bring it together. And it is actually not more effective, but as effective and better for you than being given before the head is crowning. So what very often happens is the head is here, that tissue hasn't had an opportunity to thin and stretch, and the local anesthetic is given, and now it's taken away your feedback mechanism of actually knowing what is happening there, and it is now unable to stretch because the tissue is swollen and all the cells in the tissue is swollen up with that local anesthetic. So sit with that for a little bit. It may feel really uncomfortable, and it may think, oh my goodness, I just can't imagine it. But this is also an aspect of working with the fear that you have around that and how you can move beyond it. It's really important that you're able to move beyond it so that it doesn't get in the way of you getting to that point of actually being able to birth your baby. So you don't want to get to the point of actually dilating and going all the way through labor. And then when your head is, the baby's head is there and you're feeling the pressure, that fear kicks in and you're unable to push effectively, or you go into a state of almost panic and unable to move beyond that element. So working with fear around it is also incredibly important. But this part and this video is about having the discussion about local anesthetic and understanding when it should be used and how it could get in the way and be counterproductive if you're trying to avoid an episiotomy.